Vision is the sense most directly connected with safety, autonomy, and freedom in those who have reached the maturity of life. When we talk about aging, we often think of weaker bones, muscles that lose strength, or even the natural fatigue that comes with age. However, little is said about the true invisible axis that sustains all these capacities, seeing clearly. After the age of 60, any alteration in vision becomes a critical factor, not only because it makes it difficult to read a book, watch television, or recognize faces, but mainly because vision determines how the body moves in space. It guides every step, every gesture, and every reaction to obstacles that appear along the way. When vision fails, independence weakens, and the risk of falls, accidents, and fractures increases alarmingly. This point is so relevant that major public health studies have already shown that vision loss, even when considered moderate, is among the main factors of disability in the elderly, surpassing even chronic diseases such as hypertension and diabetes when it comes to daily autonomy. A detail many people ignore is the intimate relationship between vision and balance. The human body relies on three main systems to stay steady: the vestibular system, located in the inner ear, the proprioceptive system, sensation in muscles and joints, and the visual system. Of the three, vision provides the fastest references to avoid falls. If an older person stumbles on a step, vision alerts the brain in milliseconds, adjusting posture. If vision is blurred due to cataracts, glaucoma, or outdated lenses, that alert arrives late or not at all, and the fall happens. Therefore, when we talk about independence, we are not only dealing with reading small letters, but with preventing situations that can put life at risk, such as a fall that leads to a hip fracture. That fracture, in turn, triggers a cycle of hospitalizations, surgeries, loss of mobility, and even depression, marking a turning point in the lives of many older adults. Another aspect often neglected is the emotional impact of vision loss. Older people with reduced vision tend to isolate themselves more, avoid going out at night, refrain from group activities, and even step away from hobbies that once brought joy, such as sewing, reading, or cooking. This isolation is not only a consequence of low vision, but also an additional risk factor for depression, anxiety, and even cognitive decline. Science has already demonstrated that loneliness is as harmful as smoking or being obese, and poor vision can be the silent doorway to that social isolation. What begins as "I can't read well anymore" can quickly turn into "I don't want to leave the house because I'm afraid of falling." This shows that vision, more than a physical detail, is also a pillar of mental and emotional health. It is important to remember that not all vision loss is inevitable or irreversible. Many of them have accessible solutions: updated glasses, proper lighting, eye drops for dry eye, regular medical checkups, and in specific cases, surgery. But what truly matters is the awareness that vision should be treated as an absolute priority after the age of 60. With each year that passes without reviewing eye health, the risk of falls and loss of independence increases silently. And what is at stake is not only the sharpness of images, but also the freedom to walk alone to the bakery, to dance at a family party, or to simply walk through the backyard without fear. Therefore, when we talk about the impact of vision on independence after 60, we are talking about something that goes far beyond the physical. It is about preserving the dignity, confidence, and autonomy that everyone wishes to maintain when growing older. To see well is to walk safely, to avoid hospitalizations, and to sustain the ability to decide one's own life. Vision is the bridge between the internal and external world, and when that bridge weakens, the whole structure of independence begins to crumble. Understanding this impact is the first step toward valuing eye care not as a luxury, but as a vital necessity. Cataracts are probably the best-known eye disease among the elderly, but paradoxically, they are also one of the most underestimated. This happens because the process is slow, progressive, and silent, so the patient gradually adapts to the loss of clarity without realizing how much vision has already been compromised. The crystalline lens, the eye's natural lens, becomes opaque with age, and what should be transparent becomes a barrier that scatters light. At first, the person experiences only blurred vision, as if looking through a dirty glass or light mist. Later, colors lose vibrancy, contrast sensitivity decreases, and nighttime lighting becomes an almost insurmountable challenge. The big problem is that many accept this loss as something natural with aging and stop seeking solutions, when in reality, cataracts are a perfectly treatable condition. The practical impact of cataracts goes far beyond difficulty seeing clearly. Studies have shown that untreated cataracts are directly associated with increased falls, domestic accidents, and functional limitations. This is because the lack of visual clarity alters depth perception, makes the elderly misstep, stumble over small obstacles, and feel insecure in poorly lit environments. Many stop going out at night, avoid driving, or simply lose the pleasure of simple activities such as reading a newspaper or watching television. In other words, cataracts compromise not only vision but also freedom and self-esteem. This is where it becomes an invisible enemy. By normalizing clouded vision as something that comes with age, society perpetuates a cycle of loss of autonomy that could be reversed. Another crucial detail is the inequality in access to treatment. In many places, cataract surgery is still seen as a distant resource, reserved only for those who are nearly blind. This mentality is outdated, as science shows that operating early, when vision begins to compromise quality of life, brings immense benefits. The surgery, considered one of the safest and most effective in modern medicine, consists of removing the opaque crystalline lens and replacing it with a transparent artificial lens, restoring clarity almost immediately. Technological advances even allow intraocular lenses that correct myopia, hyperopia, and astigmatism, reducing dependence on glasses. But the main point is, surgery is not only about recovering vision, it also drastically reduces the risk of falls and improves mobility, directly impacting healthy life expectancy. It is also interesting to note the positive psychological impact after surgery. Many elderly people report a sense of rebirth when they see colors vividly again, recognize family members' faces from a distance, and perceive details that had been fading for years. This improvement in vision translates into greater confidence, willingness to go out, resumption of hobbies, and reduction of the fear of accidents. For those who spent years believing that it was normal not to see well, the experience of regaining vision is almost always accompanied by emotion and gratitude. This emotional aspect needs to be highlighted because it shows that cataracts are not only a physical disease, but also a thief of experiences and memories that could have been lived fully. However, the cultural barrier persists. Many older people delay surgery out of fear, lack of information, or simply because they heard from acquaintances that poor vision is part of aging. This myth must be broken. Aging does not mean accepting gradual darkness, and modern medicine already offers safe and accessible solutions. When vision begins to limit daily activities, that is the moment to seek an ophthalmological evaluation and discuss surgery. The sooner the procedure is done, the greater the benefits for quality of life, fall prevention, and preservation of independence. Ignoring cataracts is giving up years of autonomy and safety that could be guaranteed with a simple intervention. Thus, cataracts are the visible enemy disguised as normality. They do not appear suddenly but slowly take over the field of vision until they turn the world into a cloudy and dangerous place. Recognizing this process, combating it with information, and seeking treatment at the right time is essential for those who want to age with dignity. The final message is clear. Do not accept seeing less and less as if it were a natural part of aging. Science has already shown that it is possible to recover vision and with it, restore safety, freedom, and the joy of living. Glaucoma is one of the most treacherous eye diseases because, unlike cataracts, it shows no clear signs at the beginning and causes no pain to alert the patient. That is why it is called the silent thief of sight. It gradually destroys the fibers of the optic nerve in a slow and irreversible way, without warning until the visual loss is advanced. What happens is that intraocular pressure, when dysregulated, progressively damages this nerve responsible for carrying visual information from the retina to the brain. The older adult believes he sees normally, but little by little the visual field begins to close from the sides, as if looking at the world through a narrow tunnel. When the problem is finally noticed, often the damage is already significant, and there is no way to recover what has been lost. The seriousness of glaucoma lies in the fact that it is one of the leading causes of irreversible blindness in the world. Unlike cataracts, which can be corrected surgically, glaucoma has no cure, only control. This means that once diagnosed, the goal is to stop or slow its progression as much as possible. This feature brings a particular urgency. The earlier it is detected, the easier it is to preserve functional vision throughout life. The major barrier, however, is that most people do not know they have glaucoma. It is estimated that almost half of patients live with the disease undiagnosed. In older adults, this data is even more concerning, since prevalence increases with age, becoming a concrete risk after 60. The hereditary factor also carries great weight. Those who have parents or siblings with glaucoma should consider themselves at high risk and seek periodic ophthalmological evaluation. In addition, there are more vulnerable groups such as diabetics, hypertensive patients, and people who have had previous eye injuries. But the key point is that any older adult, even without symptoms, must undergo preventive exams. Tonometry, which measures intraocular pressure, is simple, fast, and painless. Associated with fundoscopy and visual field mapping, it can reveal initial signs not yet perceived in daily life. This routine assessment should be as important as a cardiological or orthopedic checkup, because the silent risk of glaucoma is as serious as an undiagnosed vascular disease. Another aspect that deserves attention is treatment adherence. Once diagnosed, the patient may need to use eye drops daily, often more than once a day, to keep eye pressure under control. In some cases, the doctor may recommend laser or surgery, but the vast majority depends on discipline in using the medications. The problem is that many older adults forget to apply the drops, do not understand their importance, or simply abandon treatment when they feel well, since there is no pain or apparent discomfort. This behavior allows the disease to progress silently, compromising more and more peripheral vision until it reaches the point of rendering central vision useless. That is why family members and caregivers also need to be attentive, helping to remind and reinforce the importance of continuous treatment. Glaucoma does not compromise only sharpness of sight, but the entire sense of space and mobility. An older person with peripheral vision loss begins to struggle to cross the street, notice lateral obstacles, and even recognize facial expressions in social encounters. This direct impact on social life, combined with the risk of falls, makes glaucoma a threat not only to vision, but also to quality of life and independence. Current medical science already has effective resources to contain the disease, but none of them work if diagnosis comes too late. The fundamental message, therefore, is clear. Regular exams are the only weapon against the silent thief of sight. To see well after 60 does not depend only on glasses or cataract surgery. It also depends on constant vigilance against glaucoma, which can steal vision permanently, without the person realizing it. It is a treacherous disease, but one that can be contained when faced with discipline, medical follow-up, and information. The silence of glaucoma must be broken by the awareness that seeing is not just a privilege, but a right that can only be protected with active prevention. Age-related macular degeneration, known by the acronym AMD, is one of the leading causes of vision loss in older adults, and what makes it especially devastating is the target it chooses: central vision. It is precisely this region of the retina, called the macula, that allows us to see fine details, recognize faces, read, drive, and perform tasks that require precision. When AMD begins to develop, the person perceives small distortions, straight lines that appear wavy, or dark and blurred spots right in the center of the visual field. This type of loss cannot be compensated by ordinary glasses because it is not a matter of refraction, but of progressive damage to retinal cells. This feature makes the disease feared and often misunderstood, as its progression can lead to great dependence and limitation in daily life. There are two main forms of AMD, dry and wet. The dry form is more common, representing the majority of cases, and advances slowly with the accumulation of deposits called drusen in the macula. The wet form, although less frequent, is more aggressive and causes rapid vision loss due to the abnormal growth of blood vessels under the retina, which bleed and destroy central vision cells. The problem is that the transition from dry to wet can happen unexpectedly, and without medical follow-up, the diagnosis comes too late. This sudden advance is responsible for many cases of severe vision loss in older adults, reinforcing the importance of early detection and regular ophthalmological evaluation. The impact of AMD is not limited to the physical aspect of vision. When an older adult loses the ability to recognize details in the center of vision, simple activities such as reading a medicine leaflet, counting money, or identifying who is in front of them become a challenge. This limitation generates frustration, shame, and social isolation, as the person begins to avoid situations in which they cannot interact normally. Once again, isolation linked to vision loss opens doors to depression and even cognitive decline, since the brain is no longer stimulated by the same activities. Aging with untreated AMD means losing not only clarity, but quality of life in a profound and irreversible way. One of the most important points in raising awareness about AMD is that there are practical ways to monitor vision at home. The Amsler grid test is a simple and accessible example. It is a sheet of paper with a grid in which the person looks at a central point, covering one eye at a time. If the lines appear wavy, broken, or with spots, this may indicate changes in the macula and should lead to immediate evaluation by an ophthalmologist. It is a test that takes only 60 seconds, but it can mean the difference between diagnosing early and containing progression or discovering too late when the damage is already irreversible. This home screening tool needs more dissemination, as it empowers the older adult and their family to act quickly at the first signs. In the field of treatment, there have been significant advances. For the dry form, there is still no cure, but studies have shown that supplementation with the AREDS2 formula, composed of specific antioxidants such as lutein and zeaxanthin, in addition to zinc and copper, can reduce disease progression in intermediate stages. It is important to highlight that this supplement does not prevent AMD in those who do not have the disease and does not reverse established damage. Its function is to slow evolution. For the wet form, intraocular injections of anti-angiogenic drugs are a game changer, as they block the growth of abnormal vessels and stabilize or even improve vision in many cases. Although initially frightening, these treatments are now a safe and effective routine in ophthalmologic practice. For all these reasons, AMD must be seen as a concrete threat to the visual independence of older adults. It does not present itself as a gradual blur, but as a direct attack on the center of vision, that most precious point that allows full interaction with the world. Informing, diagnosing early, and treating properly are fundamental steps to prevent thousands of older adults from losing not only clarity, but also confidence, autonomy, and the joy of living. The message is direct. Do not ignore spots, distortions, or difficulties seeing what is right in front of you. Central vision is irreplaceable, and protecting it is protecting the very essence of daily life. Few realize how decisive a simple pair of glasses can be for the safety and independence of an older adult. When we talk about eye health, most people immediately think of diseases such as cataracts, glaucoma, or macular degeneration. But there is a silent villain that infiltrates the daily lives of millions: outdated glasses. Old, scratched, poorly adjusted lenses, or those with the wrong prescription, not only impair visual sharpness, but also directly affect depth perception, balance, and confidence while walking. This means that, in many cases, the risk of tripping, falling, and accidents is not due to a serious disease, but to an object the older adult carries on their face every day without realizing it has become a problem. The natural aging of the eye already alters the ability to focus, a process called presbyopia, which requires frequent adjustments to prescription lenses. In addition, even those who have worn glasses for decades may develop changes such as astigmatism or refractive shifts that can only be detected through regular ophthalmological consultations. The problem is that many older adults keep the same pair of glasses for years, believing they are still fine. The result is blurred vision, difficulty seeing details, a sensation of visual fatigue, and increased vulnerability in outdoor or poorly lit environments. Even worse, outdated glasses trick the brain into creating a false sense of distance, leading to stumbles on steps, collisions with furniture, and falls on uneven sidewalks. Another critical point is the physical condition of lenses and frames. Scratched, fogged, or worn-out anti-reflective lenses drastically reduce visual clarity, especially at night when reflections from headlights and streetlights further hinder mobility. Bent or poorly fitted frames can also cause subtle distortions that confuse the visual field. This set of seemingly minor factors contributes to a domino effect. The older adult starts walking more slowly, loses confidence, avoids leaving home, and enters a cycle of isolation that impacts both physical and mental health. It is worth noting that the impact of outdated glasses is not limited to the risk of falls. They also affect crucial daily activities such as reading medication instructions, seeing traffic signs, using a cell phone, or recognizing faces at a distance. Mistakes in these contexts can have serious consequences, such as taking the wrong medication dosage, crossing the street at a dangerous time, or missing out on important social interactions. Blurred vision caused by inadequate glasses is an invisible obstacle that constantly weakens autonomy, gradually eroding the older adult's confidence in their own abilities. Fortunately, the solution is simple: regular ophthalmological consultations and periodic updating of glasses. Ideally, prescriptions should be reviewed every 1 or 2 years, depending on eye health and clinical conditions. In addition, investing in quality lenses with blue light protection and anti-reflective treatments can bring significant visual comfort. It is also important for the older adult to test their glasses in different situations, reading, walking, computer use, and outdoor activities, to ensure they truly meet daily needs. In some cases, different glasses may be recommended for different tasks, or even multifocal lenses, provided the patient is well guided and adapted. Seeing well is not a luxury, it is safety. A good pair of glasses can be the difference between walking with confidence or living under the constant risk of falls. Treating glasses as a priority, not as a secondary accessory, ensures not only sharper vision, but also preserves freedom of movement, maintains independence, and protects life. The message is clear: do not accept stumbling because of old lenses. Updating glasses is one of the fastest, most accessible, and most effective ways to protect vision, and with it, the autonomy of those who have reached old age. When we think about vision problems in older adults, we immediately associate them with eye diseases such as cataracts, glaucoma, or macular degeneration. However, there is a factor often overlooked that can be as dangerous as these diseases: long-term medication use. The so-called polypharmacy, the simultaneous use of multiple medications, is common after the age of 60, and many of these drugs, while necessary to treat heart, neurological, or psychological conditions, have side effects that directly affect the eyes. This connection is rarely discussed, but has a huge impact on quality of life, risk of falls, and even the worsening of existing eye conditions. A classic example is medications with anticholinergic effects, present in some antidepressants, antihistamines, bladder control drugs, and even painkillers. They reduce the natural production of tears, leading to dry eyes. Dry eye, often treated as something trivial, compromises visual clarity, causes a constant sensation of grit in the eyes, and increases light sensitivity. For an older adult, this means blurred vision at crucial moments, such as descending stairs or walking in dim environments, multiplying the risk of trips and accidents. In addition, untreated dry eye can cause small corneal injuries, further worsening visual quality. Another group of medications that deserves attention are corticosteroids. Their prolonged use, whether in pill, cream, or eye drop form, is associated with an increased risk of developing cataracts and glaucoma. This creates a dangerous side effect. While the medication controls an inflammatory or respiratory condition, it may silently prepare the ground for a serious eye problem. Since the progression of these conditions is slow, the older adult, and even some healthcare professionals, may not immediately connect medication use with worsening vision, delaying diagnosis and treatment. Blood pressure and heart medications can also interfere with vision. Some beta blockers, for instance, are associated with visual disturbances and even changes in color perception. Diuretics may alter fluid balance in the body, causing temporary blurred vision. Medications for erectile dysfunction, widely used by older men, can also affect ocular circulation and, in rare cases, are linked to sudden vision loss. Even if these effects are not frequent, the mere possibility requires regular ophthalmological follow-up, especially in patients with a history of eye disease. It is also important to highlight the impact of medications that cause drowsiness or dizziness. Benzodiazepines used for anxiety or insomnia can reduce alertness, delay reflexes, and impair motor coordination. Combined with impaired vision, they create a high-risk scenario for falls. The older adult does not stumble only because they see less, but also because the body's response to visual stimuli is slowed by the medication's action. This interaction between brain, vision, and balance is a clear example of how inadequate or unreviewed medication use can be dangerous. The solution is not simply to suspend medications, after all, many of them are essential to maintain health, but to carry out periodic reviews with the doctor to evaluate whether they are still necessary, whether there are alternatives with fewer side effects, and how to compensate for their impact on the eyes. This practice is called medication review and is already part of international recommendations for older adults. Talking with the ophthalmologist about all current medications is also crucial, as many ocular symptoms that seem like new diseases may actually be related to adverse effects of already known drugs. Caring for vision in old age does not mean only visiting the ophthalmologist and wearing proper glasses. It also means looking into one's own medicine cabinet and understanding that some pills, no matter how harmless they may seem, may be silently compromising visual quality. The central message is clear. Eye safety depends as much on the eyes as on the list of medications. Ignoring this connection may cost not only visual clarity, but also the autonomy, confidence, and even the life of an older adult faced with a simple slip caused by blurred vision. Dry eye is often treated as a minor inconvenience, something many believe to be normal with age, but in reality, it is a problem that can significantly compromise vision and quality of life in older adults. After the age of 60, tear production naturally decreases, and the tear film, which should protect, lubricate, and nourish the eyes, becomes unstable and insufficient. This process leads to symptoms such as burning, a constant sensation of grit, redness, blurred vision that improves after blinking, and even difficulty remaining in air-conditioned or ventilated environments. Although it may seem like mere discomfort, dry eye has a direct impact on visual clarity, balance, and even fall risk, becoming a risk factor that is often overlooked. What few people know is that tears do not only moisten the eyes. They are composed of 3 layers, aqueous, lipid, and mucus, that work together to keep the ocular surface stable and transparent. When this structure breaks down, the light entering the eye scatters, creating blurriness and glare that make it difficult to see details. This explains why many older adults with dry eye report that they see better after blinking, since blinking momentarily reorganizes the tear film. However, this constant oscillation between seeing well and poorly creates insecurity, especially when walking in dimly lit areas or descending stairs, increasing the risk of accidents. Beyond natural aging, several factors contribute to dry eye in the elderly. Prolonged medication use, especially anticholinergic drugs, antidepressants, and antihypertensives, reduces tear production. Autoimmune diseases, such as rheumatoid arthritis and Sjögren's syndrome, also raise the risk. Eye surgeries, such as cataract removal, can temporarily destabilize the tear film. Even the habit of spending many hours in front of screens, increasingly common among connected seniors, reduces blink frequency and worsens dryness. This combination of factors makes dry eye not only an ocular condition, but also a reflection of lifestyle and health context in older adults. Another concerning aspect is the social and emotional impact of dry eye. Constant burning and blurred vision lead many older adults to avoid prolonged reading, give up watching television due to discomfort, or even stop going out because light bothers them. This isolation, already common among those with vision loss, can be aggravated by a seemingly simple problem that undermines willingness to engage in daily activities. When untreated, dry eye can also lead to more serious complications, such as corneal injuries, infections, and scarring that permanently compromise vision. Treatment for dry eye is, in many cases, simple and accessible. The use of lubricating artificial tears is the first step and usually brings immediate relief. In more severe cases, the doctor may prescribe anti-inflammatory eye drops, punctal plugs to retain natural tears, or even light-based therapies that stimulate the eyelid glands. But the central point is that it is not enough to just use any eye drops. A proper diagnosis is necessary to identify the main cause and choose the right treatment. In addition, environmental changes, such as avoiding fans directly on the eyes, increasing air humidity, and taking regular breaks when using screens, can greatly reduce symptoms. Dry eye, therefore, should not be treated as an irritation of aging. It is a condition that, if ignored, robs quality of life and safety. Recognizing its symptoms, seeking medical evaluation, and following a treatment plan means more than relieving discomfort. It means ensuring stable vision, reducing accident risks, and preserving independence. The message is clear. Do not accept living with burning, itching, and blurred eyes as if it were normal. Caring for eye lubrication is caring for clarity, mobility, and dignity in old age. One of the greatest challenges in preventing eye diseases in older adults is late diagnosis. Often, a person only discovers they have a problem when vision loss is already significant and irreversible. For this reason, simple tools that allow vision monitoring at home gain enormous value, and among them, the most well-known and effective is the Amsler grid. It is an extremely quick test, taking less than a minute, but it can be decisive for identifying changes in the macula, the central region of the retina responsible for fine detail vision. It is a resource any older adult can have printed at home, placed on the refrigerator or in the bedroom, functioning as a true early detector of problems such as age-related macular degeneration, AMD. The functioning is simple. The Amsler grid is nothing more than a square filled with straight lines forming a grid pattern with a central point in the middle. The older adult should cover one eye, focus on that central point, and observe the surrounding lines. With healthy vision, all lines appear straight and uniform. However, if some lines appear wavy, distorted, disappear, or dark spots appear in the visual field, this may indicate changes in the macula. The same process is repeated with the other eye. The entire procedure takes less than 60 seconds and requires no sophisticated equipment. Still, it can make the difference between detecting a serious problem early and allowing it to progress silently. The great power of this test lies in giving older adults a tool for self-care. By performing the Amsler grid regularly, weekly, or whenever they notice visual discomfort, individuals become protagonists of their own eye health. Small distortions that would often go unnoticed in daily life are identified quickly. And by bringing these results to the ophthalmologist, the patient helps the doctor intervene earlier, whether with complementary exams, treatment adjustments, or even the start of specific therapies for AMD. This patient empowerment is crucial as it reduces the gap between the appearance of early signs and the initiation of appropriate care. It is important, however, to emphasize that the test does not replace medical evaluation. The Amsler grid works as screening, as an alert. If the older adult notices wavy lines, gaps, or spots, this does not mean a confirmed diagnosis, but rather a sign that it is necessary to urgently seek a specialist. The most common mistake is ignoring these changes, thinking it's just age or that the problem will go away on its own. On the contrary, the sooner it is investigated, the greater the chances of stabilizing the disease and preserving central vision. Neglect in this case can cost the definitive loss of sharpness in essential activities such as reading, writing, and recognizing faces. Another benefit of the test is its virtually zero cost. It can be printed on any sheet of paper, and digital versions exist for tablets or computers. This means there is no excuse for not using it. It is accessible, fast, and can save vision. Many doctors recommend that patients at risk for AMD keep the grid in a visible spot at home, such as on the refrigerator door, to remind them to perform the test frequently. Turning the test into a habit is as important as measuring blood pressure or blood glucose, because it helps monitor one of the most precious senses, vision. In summary, the 60-second home test is a perfect example of how small actions can bring enormous benefits to the eye health of older adults. It is simple, quick, inexpensive, and highly effective at identifying early signs of serious problems. More than a piece of graph paper, it is a tool for protecting autonomy and independence. After all, preserving central vision means preserving the ability to live fully, safely, and confidently. The message is clear. 1 minute per week may be enough to save years of clarity and freedom. When we talk about age-related macular degeneration, AMD, one of the most important points is to separate what truly has scientific support from what circulates as promises or miracle cures on the internet. Among all the options studied, the formula known as AREDS stands out for having solid evidence of efficacy in slowing the progression of the disease at certain stages. AREDS means Age-Related Eye Disease Study, a large multi-center study initiated in the United States that evaluated thousands of patients with AMD. The first version, called AREDS, had already shown promising results, but it was in the second phase, AREDS, that scientists refined the nutrient combination, making it safer and more effective, especially for smokers and former smokers. The composition of AREDS2 includes specific antioxidants and carotenoids, such as lutein and zeaxanthin, along with zinc, copper, and vitamins C and E. These nutrients act directly on the oxidative stress affecting the retina, helping reduce the progression of intermediate AMD to the advanced form. In practical terms, studies showed that patients with intermediate AMD who consistently used this supplementation had about a 25% reduction in the risk of severe central vision loss. This is significant because we are not talking about cosmetic improvements, but about preserving the ability to read, recognize faces, and maintain autonomy in simple daily tasks. However, it is essential to emphasize, AREDS2 does not prevent macular degeneration in those who do not have the disease, and it also does not reverse the already established damage. Its role is to slow progression in cases diagnosed at the intermediate stage. This point is crucial because many older adults, upon hearing about the supplement, begin taking it without medical evaluation, believing they are protecting their eyes preventively. The result is unnecessary expense and, in some cases, even health risks, since high doses of zinc can cause gastrointestinal side effects and interact with other medications. The supplement must always be prescribed and monitored by an ophthalmologist, based on detailed examinations that confirm AMD at the indicated stage. Another important detail is the replacement of beta-carotene with lutein and zeaxanthin in the AREDS2 formula. This change was fundamental because studies showed that beta-carotene increased the risk of lung cancer in smokers and former smokers. Lutein and zeaxanthin, naturally present in foods like kale, spinach, and egg yolk, proved safe and effective. This modification made the formula a more balanced option, applicable to a larger portion of the elderly population. Furthermore, the choice of these specific carotenoids was not random. Both concentrate in the macula, forming a natural filter against blue light and oxidative stress that accelerates degeneration. It is worth remembering that supplementation does not replace healthy lifestyle habits. Consuming a diet rich in leafy green vegetables, omega-3 rich fish, and a variety of fruits, along with regular physical exercise, contributes to eye health in general. Likewise, controlling chronic conditions such as hypertension, diabetes, and high cholesterol is essential to protect the retinal blood vessels. AREDS2 should be seen as an additional tool, not as a standalone solution. When used in the correct context, within a medical follow-up plan, it can offer precious years of preserved vision for at-risk patients. In summary, AREDS2 represents one of the greatest scientific achievements in AMD care, but it must be used responsibly. It is not for everyone. It does not replace medical visits, nor does it correct already installed damage. It is a strategy that, when applied at the right time and with proper guidance, can make the difference between quickly losing central vision or maintaining it stable for much longer. The message for older adults is clear. Do not be carried away by trends or easy promises. Talk to your ophthalmologist, undergo the necessary tests, and if indicated, use AREDS2 as a proven ally in the fight to preserve vision. Cataracts, as we have already seen, are one of the most common vision problems in older adults and, at the same time, one of the most underestimated. But what many do not know is that cataract surgery is not just a procedure to see better. It is, provenly, a preventive measure against falls, one of the main causes of hospitalizations and loss of independence in older age. This point completely changes how we view the decision to operate. It is not about vanity or luxury, but about safety and life protection. Large-scale scientific studies have already shown that older adults who undergo cataract surgery have a significant reduction in the risk of falls and fractures. This happens because, by removing the opaque crystalline lens and replacing it with a transparent artificial lens, the patient regains not only sharpness of vision, but also contrast, depth perception, and confidence in their own steps. Imagine walking down a poorly lit staircase with cloudy vision. The chance of losing balance is enormous. Now, by restoring visual clarity, each step becomes visible again, drastically reducing the risk of stumbling. This difference is so impactful that some researchers compare cataract surgery to a true public health intervention against falls in older adults. Another relevant detail is that advanced cataracts alter the perception of colors and contrasts, making it difficult to identify rugs, uneven floors, and obstacles on the ground. This increases the risk of slipping inside one's own home. After surgery, many patients report not only improved vision but also better balance, posture, and safety while walking. Documented cases exist of older adults who, before surgery, drastically limited their social lives out of fear of falling, and who, after surgery, returned to attending gatherings, churches, parks, and even driving in controlled environments. This shows that the impact is not only physical but also emotional and social. It is also important to highlight that modern cataract surgery is extremely safe. Usually performed under local anesthesia, it takes only a few minutes and allows discharge on the same day. The complication rate is minimal, especially when compared to the risks of a fall that may result in a hip fracture, one of the most serious occurrences in older adults. Such fractures often lead to complex surgeries, long periods of immobilization, loss of independence, and even increased mortality within the first year after the accident. Thus, delaying cataract surgery out of fear or believing that vision is still manageable is, in many cases, a choice that exposes older adults to far greater risks. Another often overlooked aspect is the relationship between vision and the brain. Studies show that older adults who undergo cataract surgery also experience improvements in cognitive functions as the brain once again receives clear visual stimuli, reducing the overload caused by the constant effort to decipher blurred images. This reinforces the idea that the surgery is not only for the eyes, but for the entire body. Preserving visual clarity means preserving mobility, memory, attention, and overall quality of life. Therefore, cataract surgery should not be seen as the last resort when vision is almost gone, but as a preventive strategy to ensure safety and independence. Operating early, when vision already begins to interfere with daily life, is much more effective than waiting for functional blindness. The message is direct. Surgery restores sharpness, reduces falls, protects against fractures, and restores the freedom to live without fear. Treating cataracts is caring not only for the eyes, but also for the physical integrity and dignity of those who wish to age with autonomy. One of the most neglected aspects when talking about accident prevention in older adults with vision problems is the environment in which they live. The home, which should be a space of protection and comfort, can turn into a field of traps when it is not adapted to the visual needs of the elderly. Poorly lit steps, dark hallways, loose rugs, shiny floors that cause reflections, and even the inadequate choice of light bulbs are factors that significantly increase the risk of falls. For those already living with cataracts, glaucoma, macular degeneration, or outdated glasses, these environmental details can mean the difference between walking safely and suffering a serious accident. Lighting is, without a doubt, the first barrier of protection. Older adults need up to 3 times more light than young adults to see with the same clarity. This means that environments with weak or poorly positioned bulbs become true visual traps. Direct, strong lights, however, can also be harmful, as they cause glare and worsen the vision of those with increased ocular sensitivity. The solution lies in balance, well-distributed, preferably diffused lighting that illuminates the entire area without creating shadows or intense reflections. Critical points such as staircases, hallways, bathrooms, and kitchens should have reinforced lighting to ensure every detail is visible. Another essential resource is contrast. For those with reduced visual sensitivity, distinguishing similar surfaces becomes a challenge. A light-colored step on a light-colored floor, for example, may go unnoticed and cause a fall. Painting stair edges with strong colors, using dark anti-slip strips on light floors or light ones on dark floors, and visually highlighting handrails and doors are simple measures that reduce accidents. Contrast can also be applied to everyday objects. White plates on dark tables, light switches on dark walls, brightly colored towels in white bathrooms. Small adjustments that expand visual perception and facilitate autonomy for the elderly. In addition to lighting and contrast, it is essential to eliminate structural risks. Loose rugs should be removed or fixed with anti-slip material. Furniture should be arranged to allow free circulation without sharp corners exposed in passage areas. Bathrooms need securely fixed grab bars and anti-slip floors, since humidity increases the risk of falls. Another important measure is to keep everyday objects within easy reach, preventing older adults from stretching or climbing on stools to get them. The combination of impaired vision with risky movements is one of the main causes of domestic accidents. Technology can also be an ally. Motion sensors that automatically turn on lights in hallways and bathrooms at night prevent tripping in the dark. Emergency lights guarantee illumination in case of power outages. Even smart bulbs, which allow adjusting light intensity, can be useful to adapt the environment to the visual needs of older adults throughout the day. These resources, once seen as superfluous, are now practical and accessible strategies to make homes safer and more functional. The key point is that adapting the environment is not just an aesthetic or comfort measure, it is a health measure. Many accidents that lead older adults to hospitalizations could be avoided with simple adjustments in lighting, contrast, and household organization. Protecting vision also means protecting the space where it is used. The home should be thought of as an extension of medical care, and every detail of the environment can be either an ally or an enemy. The message is clear. Seeing well depends as much on the eyes as on the light and colors that surround the elderly. Investing in a safe environment is investing in quality of life, autonomy, and prevention of accidents that can turn aging into a daily struggle. Caring for vision after the age of 60 does not only mean changing glasses when reading starts to fail. Above all, it means undergoing specific and periodic exams that allow the identification of silent diseases and prevent small signs from progressing to irreversible losses. The great trap of ocular aging is precisely the absence of symptoms in the early stages of many conditions, such as glaucoma or age-related macular degeneration, AMD. By the time the older adult notices a clear change in vision, the damage is often already consolidated. That is why some ophthalmological exams should be seen as an absolute priority, not as a secondary option. The first of these is the visual acuity test, the most well-known, which measures the ability to see letters and symbols at different distances. Although simple, it is essential for properly adjusting glasses and detecting subtle changes that may indicate disease progression. Next is ocular tonometry, which measures intraocular pressure. This exam is quick, painless, and crucial for diagnosing glaucoma, the silent thief of vision. Without tonometry, there is no way to identify early the increase in pressure that damages the optic nerve. Another indispensable exam is the sut fundus examination, which allows direct observation of the retina, macula, and optic nerve. It reveals early changes that may indicate macular degeneration, diabetic retinopathy, or early signs of glaucoma. The retinal mapping, a more detailed version of this process, expands the observation field and is especially important for diabetic or hypertensive patients, since these conditions directly affect the retinal blood vessels. The ULS computerized visual field test is also fundamental as it evaluates the extent of peripheral vision. It is with this exam that typical losses from glaucoma are identified, which begins by stealing lateral vision without the patient realizing it. Complementing this is the optical coherence tomography, OCT, a modern technology that provides high-resolution images of the retina and optic nerve, allowing microscopic changes to be detected even before symptoms appear. For patients at risk of AMD or glaucoma, OCT is an indispensable tool for monitoring disease progression. We must also not forget the refraction test, which ensures the correct prescription of glasses. An incorrect prescription may not only blur vision, but also compromise depth perception and increase the risk of falls. And for cases with suspected dry eye or persistent discomfort, specific exams of the tear film and meibomian glands help define more precise treatments. The key point is that all these exams, when performed regularly, form a powerful barrier against irreversible vision loss. The general recommendation is that older adults undergo a complete ophthalmological evaluation at least once a year, even if they have no complaints. This preventive care should be considered just as important as controlling blood pressure or blood sugar. After all, vision is one of the pillars of independence, and losing time in diagnosis means losing the chance to preserve years of autonomy. Seeing well is not just a matter of sharpness, it is a matter of safety, mobility, and dignity. The ophthalmological exams that cannot wait represent the link between prevention and the preservation of an active life. Ignoring them gives room for silent diseases to advance unchecked. The message is clear. After 60, visiting the ophthalmologist is not a luxury, but a vital necessity, as important as any other medical routine exam. There is no use in knowing the risks of cataracts, glaucoma, macular degeneration, or dry eye if the older adult does not adopt a practical routine that translates this awareness into daily actions. Vision is one of the most demanded senses in aging, and the secret to preserving it is not in major isolated interventions, but in small, cumulative habits that together build a barrier against accidents and irreversible losses. This is what we call the BAST, Safe Vision Routine, a set of weekly and monthly care practices that help keep the eyes working properly and at the same time protect the body against falls, hospitalizations, and social isolation. The first step in this routine is the weekly home checkup BAST. The elderly person, or a family caregiver, should walk through all rooms, checking lighting, removing loose rugs, ensuring light bulbs are working, and confirming that hallways, bathrooms, and staircases are well lit. This inspection may seem simple, but it makes all the difference, since a safe environment immediately reduces the risks associated with impaired vision. Adding visual contrasts to stair steps, edges, and furniture should also be part of this process. In parallel comes the eyeglass review. Every week it is important to check whether the lenses are clean, scratch-free, and not stained. Bent frames must be adjusted, and if there is any discomfort with the prescription, it is best to schedule a consultation for re-evaluation. Outdated glasses are one of the main causes of falls, and treating them as a priority is an essential measure of the safe vision routine. Another key point is ocular hydration. Older adults who suffer from dry eye must use lubricating eye drops as directed by their doctor and maintain humidity indoors, especially during dry weather or in air-conditioned homes. This habit should be daily, just like taking breaks during long screen activities to stimulate blinking. Small actions prevent discomfort and visual fluctuations that can compromise safety. Once a month, the routine should include self-assessment with the Amsler grid. This 60-second test is quick, free, and can reveal early signs of macular degeneration. It is also advisable for the older adult to ask themselves, have I been tripping more often? Do I struggle in dark environments? Do I need more light to read? These simple questions act as an early radar for visual problems and help identify when to seek an ophthalmologist before the situation worsens. As for medical health, the Safe Vision routine requires a mandatory annual ophthalmology consultation, even without symptoms. During this checkup, tests such as visual acuity, tonometry, fundus examination, visual field, and optical coherence tomography, when indicated, must be performed. For seniors with a family history of glaucoma, diabetes, or hypertension, this interval may be shorter, every 6 months. Reviewing the medication list must also be part of the consultation, since many drugs affect vision without the patient noticing. Another essential component is nutritional care. A diet rich in dark green vegetables, such as kale and spinach, varied fruits, omega-3 fish, and antioxidant-rich foods, contributes to the health of the retina and macula. In cases prescribed by a doctor, supplementation with AREDS2 can be included, but always under supervision. Along with this, keeping blood pressure and blood sugar under control is part of the same routine, since hypertension and diabetes are major enemies of vision. The Safe Vision routine is not a complicated protocol, but rather a practical checklist that organizes simple care into 3 levels. Daily, cleaning glasses, using drops, well-lit environments. Weekly, house checkup and small adjustments. And monthly, annual, Amsler test, medical consultations, and exams. This structure transforms eye care into a habit, reducing the risk of falls, detecting diseases early, and ensuring that the elderly maintain their independence. The message is clear: protecting vision is protecting life. Creating and following a practical routine is the most effective way to turn knowledge into real prevention. With safe vision, the older adult not only preserves visual clarity, but also strengthens the path to aging with dignity, confidence, and freedom. The best way to understand the impact of vision on an older adult's life is to observe what happens when it is lost, and, more importantly, when it is recovered. Real-life stories vividly reveal that good vision is not just a functional detail, but a factor that can literally save lives. Many older adults spend years believing that tripping, blurred sight, or nighttime difficulties are part of aging, until a serious accident occurs and exposes the importance of eye care. On the other hand, those who treat cataracts, glaucoma, or macular degeneration in time often manage to avoid falls, maintain independence, and even rediscover the joy of living. A common case is that of seniors who suffer hip fractures after falls at home, often caused by impaired vision. These accidents not only require delicate surgeries, but also lead to long periods of immobility and a sharp decline in quality of life. There are reports of patients who, after suffering severe falls, discovered that the problem was not only balance or muscle strength, but an advanced cataract that had never been treated. In many of these cases, subsequent cataract surgery not only restored sharp vision, but also prevented new falls, showing that the accident could have been prevented years earlier. Another example is people living with undiagnosed glaucoma. A 70-year-old man, for instance, noticed he could not see pedestrians approaching from the side while driving. After investigation, he discovered his peripheral vision had been compromised by glaucoma. Early diagnosis allowed treatment with drops and laser, stabilizing the disease and preventing progression to blindness. Without this discovery, he likely would have lost functional vision completely within a few years. This story reinforces the importance of routine exams, since glaucoma does not give warnings. It silently steals vision until it is too late. There are also moving cases related to age-related macular degeneration. A 68-year-old woman reported that when using the Amsler grid at home, she noticed straight lines appearing wavy. She brought the result to her ophthalmologist and was diagnosed with early-stage AMD. Treatment began quickly, including intraocular injections, and the progression was controlled. That simple act of using a 60-second home test preserved her ability to read, sew, and recognize her grandchildren. A seemingly small gesture became a turning point between dependence and autonomy. These stories make it clear that vision is not just a matter of seeing, it defines safety, balance, mobility, social interaction, and even mental health for older adults. Regaining sight through surgery or treatment does not just mean seeing better, it means returning to live. Many patients report after cataract surgery that they felt as if they had gained a new life. Colors return, confidence is restored, and the freedom to go out without fear is revived. This psychological and emotional impact is just as important as the physical one because it reduces isolation, improves mood, and reactivates social participation. Therefore, real-life stories show us that taking care of vision is much more than a medical act. It is a way to prevent tragedies, restore autonomy, and give back quality of life. Each timely exam, each initiated treatment, and each successful surgery are not just technical procedures, but chapters of lives that could have followed a path of losses and limitations and were rescued by attention to eye health. The message is clear. Do not wait for a fall or permanent loss to value vision. Life stories prove that good vision is often what separates dependence from healthy aging. Throughout this entire reflection on vision in old age, it becomes impossible to ignore the central truth. Seeing well is not just a matter of comfort, but a determining factor for survival, autonomy, and dignity in the elderly. With every step taken safely, every medication leaflet read clearly, every face recognized effortlessly, lies the proof that preserved vision is the foundation of independence. At the same time, with every stumble on a rug, every slip in the bathroom, or every late diagnosis of glaucoma, we see how neglecting eye health can cost hospitalizations, limitations, and even life itself. The conclusion is simple and powerful. Caring for vision means caring for the entire process of aging. The eyes are more than windows of the body. They are guides of movement, balance, and confidence. An elderly person with untreated cataracts walks with insecurity. A patient with undiagnosed glaucoma lives under a silent risk. Someone with advanced AMD loses the ability to even recognize their own family. On the other hand, an elderly person who undergoes annual exams, keeps their glasses updated, treats dry eye and adapts their home with proper lighting and contrast gains not only sharp vision, but also the certainty of aging without giving up freedom. It is in this border between dependence and autonomy that vision reveals itself as one of the most precious assets of life. It is also essential to understand that medical advances are available and accessible in most cases. Cataract surgery, safe and effective, reduces falls and brings colors back to the world. Glaucoma eye drops, when used correctly, preserve the visual field for decades. The AREDS2 supplement, prescribed at the right stages, slows macular degeneration and keeps central vision active. The Amsler grid, done at home, allows any elderly person to identify early signs in just 1 minute. These resources exist, and the only barrier preventing them from fulfilling their role is the lack of information and medical follow-up. Seeing well is not a luxury, not vanity, and not a whim. It is health. It is prevention against falls, against disabling fractures, against isolation and depression. It is also an emotional gift, as it allows the elderly to continue to marvel at the colors of a sunset, the delicacy of embroidery, the smile of a grandchild. Preserving vision is preserving the essence of everyday life, that which connects a person to the world and to those they love. That is why vision must be treated with the same priority as the heart, bones, and brain, because it sustains all these systems in an invisible way, guiding every step and every decision. The final message is clear and non-negotiable. To see well is to live safely. Those who care for their eyes after the age of 60 are not only avoiding accidents, but they are also ensuring the continuity of their own story with independence and fulfillment. Every exam, every adjustment of glasses, every care taken in the home environment is a way of protecting life in its fullest sense. Old age can and should be lived with freedom, confidence, and joy. And the eyes, when cared for responsibly, are the key to opening that door.